Hi everyone, my name is Asia and the topic of my presentation is psychiatric patient ethics. Here on the screen you can see a short definition of healthcare ethics. So in my opinion, ethics is a lens that helps guide our decision making. And when we're looking through this lens, we need to think of the 7 ethical principles that are viewed on this page. Justice, beneficence, non-maleficence, accountability, fidelity, autonomy, and veracity. Today we're going to focus on autonomy as it relates to psychiatric patients. Patient autonomy in the clinical context is the moral right on the part of the patient to self-determination concerning one's own healthcare. So normally patients have the right and freedom to make their own informed health decisions, but this gets complicated in terms of psychiatric patients. There is a uniqueness to psychiatry because healthcare personnel have the power to infringe upon the rights of patients in special circumstances. And also, different forms of severe mental illness can result in decreased functioning and hence reduced autonomy. Here's an example of some special circumstances where the autonomy of a psychiatric patient may be infringed upon. One example is if there is risk that this patient may cause harm to themselves or someone else, they can be placed on an involuntary hold. This is demonstrated on this photo straight from the Mental Health Act of Ontario. Another aspect in regard to respect for autonomy is confidentiality. Patients have the right of privacy and confidentiality, but there may be some circumstances in mental health patients where this must be broken. For example, in situations where the law requires medical records or in situations where a patient is at risk of harm to themselves or to others, confidentiality must be broken to ensure safety. Moving on from autonomy, I wanted to focus a little bit on the history of unethical treatment related to psychiatry patients. Here's a list of some unethical treatments that were used in the past, but I would like to focus quickly on metrazole therapy. Here's a quick video showing a patient in 1948 receiving metrazole therapy. In metrazole therapy, physicians induce seizures using a stimulant medication. Seizures began roughly a minute after the patient received the injection and could result in the fractured bones, torn muscles, and other adverse effects. The therapy was usually administered several times a week. Metrazole was withdrawn from the FDA in 1982. While this treatment was dangerous and ineffective, seizure therapy was the precursor to electroconvulsive therapy. There's been recent media coverage related to the unethical treatment of psychiatric patients. This recent news article demonstrates an example of what some men went through while in a forensic psychiatric inpatient facility. The men were forced to take mind-altering drugs such as LSD, forcibly restrained or isolated, and were confined nude and handcuffed to other men in the capsule, a tiny windowless soundproof room that was always lit and had one open toilet. They were fed through straws in the walls. So as you can see, this is a clear ethical violation of the patient's rights, and I'm glad to see that these psychiatrists and the Ontario government are being held accountable. In conclusion, sometimes it is necessary to infringe upon the ethical rights of a psychiatric patient, and healthcare professionals need to be educated on when this is acceptable. History shows that psychiatric patients have experienced unethical treatment, and I am thankful that the advancement of science and medicine has helped to eradicate some of these dangerous treatments. And here is my reference page for my entire presentation. Thank you.